Welcome student on another video lecture. Today's topic is History of Ayurvedic System of Medicine. It is about 5000-year old system of medicine native to India. So Ayurvedic system of medicine is 5000-year old system of medicine. It is holistic system of medicine which consider whole body while treating a disease and not just a disease part of the body. So whenever the treatment is given in Ayurvedic system of medicine, then it will consider whole body and not just a disease part of the body. Ayurveda has 1000 years evidence-based history, so it can just a complete system rather than alternative or complementary system. So it cannot be considered as alternative or complementary system because it is having a evidence-based history, 1000 years evidence-based history, and due to which it is just a complete system of medicine. Ayurveda in Sanskrit word which means life and Veda to gain knowledge. So Ayur means life and Veda to gain knowledge. So it is the science of life. Ayurveda deals with different types of plant, mineral, animal product. So it includes plant, mineral and animal products. Charak Samvida by Charak includes the principal component or theory of Ayurveda. Sushruta Samvida edited by Sushrut, and it is about the surgical treatment in Ayurveda. So two important treatises are there from Ayurveda. First one is Charak Samvida and second one is Sushruta Samvida. Charak Samvida is made by Charak and it contains theory of Ayurveda and principal components of Ayurveda, whereas Sushruta Samvida it contains surgical treatment in Ayurveda. It is assumed that Sushruta was born in eastern part of India near Bihar, and Sushruta was a physician by occupation. So he is physician and is born in Bihar. In Mahabharata he is represented as a son of Rishi Vishwamitra. His Samhita is divided into 6 volumes, comprises all aspects of general medicine. So Samhita which is prepared by Sushruta, it is divided into 6 volumes which comprises all aspects of general medicine. However, due to an extraordinary accuracy and detail of surgery in his work, he is also considered as father of surgery. Because of its extraordinary work and accuracy, he is considered as father of surgery. The 6th volume contains 184 chapters describing 1120 illness, 700 medicinal plant, 64 drugs prepared from minerals, 57 from animal sources. It also discusses different surgical technique suitable for different body part along with 14 different types of bandages. So the information is given about the 700 medicinal plant against 1120 illness, 64 drugs are prepared from mineral, 57 from animal sources. It also discusses different types of surgical techniques for different body part and 14 different types of bandages. It also deals with topics such as genetic, mental illness, embryology, anatomy, geriatric illness and diabetes. It has 300 surgical procedure and it classifies surgery into 5 subheadings: Arya, extraction of solid bodies; Beya, excising; Chedya, incising; Esha, probing; Lekhya, sacrificing; Sivya, suturing; Vedya, puncturing; and Visravanya, evacuating fluid. It describes more than 300 kinds of operation that call for 42 different surgical processes and 121 different types of instrument. For the purpose of anesthesia, he advised the use of wine with the essence of cannabis. This is the oldest form of anesthesia used with no world record before that. So this is the oldest form of anesthesia which is used, and there will be no record before that. And use of wine with essence of cannabis. The instrument used for surgery were constructed after the shape of beads and bird and name after them like crocodile forceps and hawk bill forceps. The Sushruta Samhita is best known for its approach and discussion of surgery. It is one of the first in human history to suggest that student of surgery should learn about human body and its organ by dissecting a dead body. So it was one of the first in human history to suggest that student of surgery should learn about the human body and its organ by dissecting the body, by dissecting a dead body. Describe hemorrhoidectomy, amputations, plastic, rhinoplastic, ophthalmic, lithotomic and obstetrical procedure. Vagbhatta, son of senior doctor Simhagupta, also compiled his work on traditional medicine. Early Ayurveda had separate school for physician and surgeon. Agnivesh, student of sage Bharadwaj, wrote the text Agnivesh Tantra which influenced the writing of Ayurveda. Madha, Sarna, Gandhara and Bhavamisra also compiled their work on Indian medicine. So this is about the history of medicine. The points to summarize or remember that include: it is the 5000-year-old system of medicine, and there are 1000-year-old evidence-based history is there, and due to which it is a complete system of medicine, not a complementary and alternative system of medicine. It is having two treaties, Charak Samhita and Sushruta Samhita. Charak Samhita, it is related with the principal component and theory of Ayurveda, whereas Sushruta Samhita, it is deal with surgical treatment in Ayurveda. After that, Sushruta, he is the physician by occupation, and because of it, his accuracy and his work, he is also known as father of surgery. His Samhita, it is consists of 6 volumes and which is made up of 184 chapters. It contains 1120 different illness, and there are 700 medicinal plants they are used for treatment of this illness, and 64 drugs are prepared from minerals, whereas 57 from animal sources. He also discuss or gives different surgical techniques for different parts of the body, and also gives information about 14 different bandages. After that, his Sushruta Samhita, it is best known for its surgery, and he is also advised about the anesthesia. He is also giving advice about the anesthesia, and in that wine as well as essence of cannabis that is used, and this is the oldest form of anesthesia. Before that there will be any record of any anesthesia. Vagbhatta, he is compiled his work on traditional medicine, and Agnivesh is wrote text Agnivesh Tantra. This is about the history of Ayurvedic system of medicine. Thank you.